Okay, thank you for having us. Our presentation today is called New Technology Approaches for Monitoring Sleep and Sleep Disorders. My name's Andrew Tucker, I'm from Sleeptite, and this presentation will actually be co-presented by myself and Associate Professor Andrew Vakulin from Flinders University. Now, I'm going to be talking about nearable technology for sleep monitoring with an aged care application as well. So let me start by saying, giving some context around wearables. So wearables such as things like smartwatches are typically rigid. Their electronics inside are brittle and breakable, and that was a problem that was addressed by a team of research engineers from RMIT University in Australia. So what they wanted to do was develop durable electronics that are conformal, stretchable and flexible so that they are to be essentially unbreakable. And they managed to achieve that probably 7 or 8 years ago now. And the two images, a couple of images there you can see on the screen, what they managed to do was transform the brittle electronics onto soft, stretchy platforms. So you can see there the transparent things that are being stretched in that image. That's electronics embedded onto a contact lens type material. So the real novelty or the innovation there was to transform the brittle electronics onto stretchy platforms to while still maintaining their full functionality. So that was the real breakthrough there. And the image to the down the bottom to the right there, that was a further development once Sleeptite started to collaborate with these researchers at RMIT, and we actually transformed those sensors to embed them onto fabric. So the real advantage of these sensors are that they're conformal, so they take the shape of whatever surface they are applied to. And the research team initially developed these sensors to be wearable, so like a skin to measure. The original concept was to measure UV to potentially reduce the risk of skin cancer over time. And what we did was transform those to, again, embed onto any fabric. So it takes the form of that fabric and stretches and flexes along with the fabric. So what essentially we have achieved from that is to transform a soft, flexible, stretchable wearable sensor into a soft, flexible, stretchable nearable sensor. Let me just go to the next slide. And that's when we developed nearable technology for sleep monitoring. And when we brought along another partner called SleepEasy, which is a bedding manufacturer in Australia, we transformed this sensor technology to be applicable to the aged care sector. And what we did was we used those sensors and embedded them onto the underside of a mattress protector. So when you're laying on the bed, you can't actually feel those sensors. So you can lay on the bed and they will monitor your biometrics or different changes in pressure without you needing to do anything. You don't need to wear anything, and that's why we call them a nearable. So these sensors are essentially imperceptible to the user. And the design of the sensors is a piezo resistance or a pressure sensor, and that can measure in real time biometrics with quite high sensitivity. So the system that we developed, we've called it the REMI system, and that can wirelessly measure body presence, body position, body posture, body movements or motion, and even respiration and heart rate without the need for the user to do anything. They don't need to wear it. And as I said, they just lay on the bed and all these things can be measured. Now, this image over here on the right of your screen, the soft pressure sensor, there's a few different layers in that sensor. So you've got the top layer, which is the blue layer, which is the mattress protector cover. Then under that, you have an encapsulation layer, the conductive ink, which is a printable ink, which is made up of silver and carbon ink formulations, and then a polyurethane layer. That's all embedded onto the underside of a mattress cover. And as I said, that's imperceptible to the user. And there are various strips of those or sections of those sensors that are distributed across the surface of the mattress. And this is a short animation that it doesn't have any sound, but it describes what the REMI system is and what I guess the use case is for the aged care sector. So, as you all know, the risk of falls in an aged care sector is quite high, and as elderly citizens or the number of elderly citizens increase over time, then the workforce is also going to be reducing over time. So the purpose of creating this REMI system was to create a tool that would allow the workforce to be more efficient and more productive over time as the population of elderly citizens increases. Now, this is just a scenario of the system that would work in an aged care facility. So you can see each bed here would have the system installed as part of the bed, and it will transmit data to the carers to be able to intervene or assist a resident when needed without disturbing the sleep of another resident who doesn't need attention. And this is the aged care facility example or use case, but the same system or the same hardware, the same sensors can also be used in an aging in place scenario. So you could actually monitor the system via an app, for example. And sorry, I've accidentally gone back. And then the last bit of the animation is just the components of a standard mattress and showing that the sensors are embedded under the mattress cover. There's a communications box which transmits the data to the cloud so that the carers can see the data, and this just shows what kind of data or an example of the kinds of data that can be collected and inferred from the system. Okay, and this will be the last slide before I hand over to Associate Professor Andrew Vakulin. So this is, I guess, a summary of what I've been describing for the aged care sector. So the REMI system, the current device capabilities, we expect to commercialise this product and for it to be available mid-2023. So that's next year. And as I was saying, the overall concept of the system is to support the aged care workforce to prioritise the provision of care for those that need it through that real-time monitoring of the status of a resident. And the capability of that first version of the system we call the 3 Ps. So we've got presence, position, and posture. And what I mean by presence is it can detect whether someone is in the bed or out of the bed. So an example use case is that if someone has gotten out of bed and gone to the bathroom or left their room and they haven't come back after a certain amount of time, then the system can notify the care staff to check on that resident. They may have fallen or they may have wandered off somewhere. Position is relative position on the bed. So if someone's close to the edge of the bed, the system can send a notification to notify someone to come in and change the position of the resident. And posture is quite an important one as well. So the system can measure whether someone is laying on their back, on their front, on their left side or their right side. And that information is potentially important to pressure care management approaches in an aged care facility in terms of being able to track the posture of a person over time, and you can be able to inform when someone needs to change position if they can't do it themselves. Another key component or another key capability of the system is that we'll also be able to integrate with other systems or dashboards so that the notifications that the REMI system emits can be, I guess, utilised by other systems that are already implemented into an aged care facility, for example. And as I said earlier, the REMI system can be used in both aged care facilities and aging in place. Thank you very much for your attention and listening, and I will now hand over to Associate Professor Andrew Vakulin from Flinders University.
Okay, thank you very much, Andy, and thank you for the opportunity to the organisers. Thanks for the opportunity to present here today. Look, so Andy covered really well the new Sleeptite REMI system and the capabilities it currently has, and we're very fortunate and lucky to be working with Sleeptite and RMIT team to develop and validate further sleep-specific capabilities. So can we measure actual sleep stages and sleep quality and sleep disorders within target populations such as aged care? And so what I'll do now, because those capabilities are not there within the RAMI system yet, I'm going to talk through generally the sort of background and science around recording sleep measurement using wearable and nearable sensors that are currently available, and just provide you some use cases and examples of why this is important. So, you know, measuring sleep is traditionally a complex task. But clinically, we get people to come into a sleep laboratory that is, you know, specifically designed to measure all sorts of physiological measures, including brainwave activity, respiration, oxygenation, and as well as movement and body position, in order to really capture how the physiology of sleep and pick up any abnormalities during the sleep period. And in fact, you know, it's so heavily instrumented that often it may disrupt sleep of individuals. Of course, there have been advances in recent years with you know, advances in technology and machine learning approaches and analytics to really enhance the use of the various physiological signals that we collect during sleep and apply these approaches to quantify new metrics and new potential markers that are shown to be related to the health outcomes that we're worried about and care about in sleep disorders. But again, with those approaches, you still require the specialized equipment and specialized laboratory to collect the data. So I think what I'll be sort of describing from here on is sort of technology like the RAMI system, where you would be using either wearable or nearable technology, and there's various different types around both under mattress, in mattress, sound, wrist-worn, as well as radar-based systems that try to essentially identify various parameters during sleep, including respiration, heart rate, position, to quantify sleep stages, as well as sleep quality and disruption during the night. So what I'll do is I'll cover some data and present some evidence of why this is, you know, why this technology is useful, and measuring multiple nights is a good idea. So we've had experience with 3 different devices. One is an early sense device, which is shown on the right image here. Goes under the mattress, measures various physiological signals, including respiration, and so it is able to quantify sleep disordered breathing or obstructive sleep apnea. And so I'll be mainly focusing on an example of obstructive sleep apnea, which is the context we use this technology most in my laboratory. And so what this slide really shows is that when you compare the ability of these sensors to measure obstructive sleep apnea in a home environment against a gold standard sleep study with all the brainwave activity and all the other physiological signals, they do pretty well. You know, they don't have any contact with the person. They're under the mattress. The person cannot feel them, but they're able to pick up and quantify obstructive sleep apnea and the severity of obstructive sleep apnea reasonably well. So I know this is a complex slide here, but really all I'm trying to demonstrate here is that a sleep disorder like obstructive sleep apnea actually varies quite a lot from night to night. And so what we've done here is use this early sense device, and we had 39 individuals that had at least 5 to 7 nights of continuous consecutive nights of recording of their sleep using this device. And we quantified the apnea-hypopnea index, which is a measure of how many times someone stops breathing, and we can quantify how severe their sleep apnea is. And so what this graph is really illustrating is the black dots is the very first night that we recorded sleep in these individuals, and then the open white circles for each individual is the subsequent night. And you can see that in some individuals, particularly to this right side of the graph, you can see that a lot of people are varying quite a lot from night to night. And what does that mean practically and clinically is that we define people into different severity categories from no sleep apnea, mild, moderate, and severe. And what the table below here really shows is that depending on the night that you happen to have your sleep assessed, it would potentially change, how many participants would be defined as having mild sleep apnea all the way to very severe sleep apnea, just depending on luck of when you had that assessment. And so having a picture of multiple nights gives you a much clearer picture of how bad sleep apnea is. This plot, again, is just illustrating that point again, and it's using two different devices, both under mattress devices. And really all it's trying to show is that as you move into this mild to moderate range of obstructive sleep apnea, you have this relatively sharp peak whereby the probability of misclassifying an individual of either having sleep apnea or not becomes very high and almost a random chance, flip of a coin type scenario. As you get more severe sleep apnea, the classification is quite robust, as well as having no sleep apnea, the risk of misclassifying it is low. But as you get in this middle category where majority of patients would sit, a single night evaluation is actually quite poor and misclassifies a lot of people. Again, this is just illustrating that how many nights would you need to actually get a better picture of somebody's sleep apnea. And so the orange lines here really indicate a single night. So you're misclassifying around 20% of people. But as you get up to 7 and particularly the 14 nights, you can see that the accuracy of identifying somebody as having obstructive sleep apnea versus not becomes very, very a lot more accurate. And so what we find in some of the data sets we've been analyzing, these are quite large data sets in about 60,000 individuals with over 190 nights, is that you can derive these clusters of individuals that either have very low variation in their sleep apnea severity from night to night, so they're essentially stable sleep apnea, and you can have these very high and very unstable obstructive sleep apnea. And you can see them across our traditional clinical mild and moderate definitions. So we basically think that this is an important new phenotype that's important to measure, and you can only measure it from measuring multiple nights within a home environment, because we feel it relates to health outcomes. And we got some evidence for this recently. Again, this plot here really illustrates that we get, if we look at hypertension, for example, and we split the apnea-hypopnea index into 4 quartiles, we can find that those individuals that illustrate high variability in their apnea-hypopnea index from night to night have increased risk of hypertension, so the quartile 4 here, irrespective of how severe their sleep apnea is clinically. So that's really important and important finding. So you could have mild sleep apnea, the doctor detects mild sleep apnea from a single night, but because you vary quite a lot from night to night, you can have anywhere from 60 to 70% increased risk of hypertension. And just quickly, I know we're running out of time, but how does this relate to aging? How does this relate to healthy aging? So as we age, both of these plots really illustrate that the time we sleep decreases. We also know that complaints of sleep problems increase as we age. So there's an increasing percentage of complaints. The sort of complaints that we find is that a lot higher reported insomnia, greater obstructive sleep apnea, more periodic leg movements, restless legs, and also REM sleep behavior disorders increase. And what we've been looking, sort of practically in sort of older individuals is falls risk. Falls risk is obviously an important risk factor as we age, and it is a very costly condition, both health-wise and economically in most health systems in the world. And what we find is, sleep is actually an important factor in predicting balance, gait, and potentially falls risk. And so here we can see that older individuals, if you measure their balance on a force platform, they will have greater variation in speed in both the anterior-posterior direction as well as the medial-lateral direction compared to younger individuals. What we also see is that sway and balance varies across time of day as well as a function of time awake. So depending on the time of day you measure somebody's sway, it'll change according to their body clock and circadian rhythm, as well as keeping somebody awake for greater than 26 hours will destabilize them and decrease their balance, potentially impacting falls risk. And we have a nice demonstration here of this in a pilot study where we actually applied a treatment to obstructive sleep apnea. So we applied continuous positive airway pressure, or CPAP, for 6 months to older people over 65. These was 28 people, and we wanted to see, does CPAP treatment reduce falls risk? And we used a comprehensive falls risk assessment measure, and indeed we found that overall CPAP was very effective at reducing fall risk in these individuals. And so from those examples and use cases, I guess using technology within the bedroom environment, under mattress, similar technology as described by Andy, and that in terms of Sleeptite and REMI, it would be very exciting and great to have the capability to measure sleep and breathing across multiple nights, because as I've shown you, it varies significantly from night to night, and the capability of measuring multiple nights would allow you to have much richer data linked to health outcomes, particularly in older populations. And so this would provide a unique opportunity that would support sleep disorder screening and monitoring in older people, help develop preventative strategies and support healthy aging. Thank you very much.
Thank you, Andy and Andrew, for the comprehensive presentations, which help us to understand more about how sleep affects our health and the future trend of using technology to understand the importance of sleep. So we shall now begin to take questions from the floor. Hi, nice to meet you, and thank you for the presentation. And we are taking questions from the floor. The first question is, what are the advantage and disadvantage of using the REMI system to monitor the sleep disorder compared to a traditional sleep study?
Sorry, I can't hear.
Oh, sorry. Okay, let me, can you hear me? Can you hear me now?
I can hear you now, yes.
Okay,
thank you.
Then I will repeat once again. What are the advantage and disadvantage of using REMI system to monitor the sleep disorder compared to a traditional sleep study?
Well, I think the advantages are that it's enairable. So the patient or the consumer or whoever's using the device doesn't have to do anything. They just have to lay in their bed. And the potential of the REMI device is that it can measure all the parameters that it needs to measure. Of course, it would need to undergo that validation that Associate Professor Andrew Vakulin is going to be working with us on. But the advantage is that the patient doesn't have to do anything, and it can be used in the home environment as well. So people can be remotely monitored. And as Andrew's presentation said, sleep disorders can happen over, their severity of the symptoms can happen differently over each night. So getting multiple nights of recording or monitoring is ideal, and they're the advantages.
And probably this is, and also some questions from the floor about sleeping disorder as well. So sleep disorder can lead to different levels of health problems, including hypertension and poor balance. What can we do to reduce these negative effects with technologies? Maybe Dr. Vakulin on this question?
Yeah, no worries. Look,
Sleep disorders is a very heterogeneous across multiple types of sleep disorders, and not everyone ends up having hypertension or impaired balance. So it's really important to identify those patients at risk. And, you know, sort of related to the previous question, we can't really do that well with a single snapshot sleep study. So even though we have gold standard polysomnography that's done in a sleep laboratory, as I've hopefully convinced you, the majority of patients vary in terms of their sleep disorder, in terms of their severity from night to night. And so technology like this allows you to monitor continuously in real time how severe sleep disorder is and how that might be linked to important health outcomes, which will lead to preventative strategies when you really define the risk factors for an individual patient. So it's towards personalized sleep medicine.
I see. Thank you. And there are some questions about the sensors as well, about probably Sleeptite, or definitely probably you may have been doing a lot of different other sleeping technology as well. The question will be, will there be any difference in accuracy between people who are obese and skinny people lying on those sensors? What is the mechanism of measurement?
Well, the mechanism for the REMI sensors is it's like a strain gauge, so it's a pressure sensor, so it's relative changes. So it doesn't really matter whether a person is thin or on the larger side. The relative changes are going to be detected for that person. So there's no standard change in pressure that we would equate to a particular movement or a heartbeat or a breath. It's all relative to that person. So it's calibrated in a way.
Thank you. Can also about the sensor, can this sensor distinguish whether a person leaves the bed automatically or falls off the bed involuntarily?
Yes, so its initial version that's going to be in aged care facilities and also the aging in place scenario, it will detect what we call the 3 Ps, which I covered briefly in the presentation. So the first one is presence, so it can detect whether a person is on the bed or not. And because when you're on the bed and you're I guess a human person on the bed, you're going to be making very small movements all the time. So we can detect whether someone's on the bed and how long they're on the bed for. And then when they get off the bed, then it's the use case, if you like, is they would start a timer for how long that person is off the bed, and if the facility has a certain threshold for if there's concerns about a resident wandering off or that they may have fallen somewhere else and they haven't come back to bed in a certain period of time, then we can send a notification out for a carer or a nurse to go and check on that resident to check that they haven't fallen. Over time, with data analytics, we'll be able to get into a position where we can predict falls. I mean, I guess at the moment, we could also say if someone moves to the edge of the bed, then we can send a notification to say that a person is too close to the edge, and you could intervene before they experience a fall.
I see. And I guess that is not just helping like elderly people, it's probably helping like babies as well. And right. There are some questions, or I guess it's a very looking forward question for you both is, besides monitoring, is there any technology that could help the sleeping quality? It seems it's a very desperate question.
I'll let Andrew take that one, I think.
Look, I think information is key. If we have information both from a perspective to the user themselves, but also to a clinician, it allows you to make some decisions around treatment. So whether it's a specific sleep disorder like sleep apnea, you'd want to be able to pick it up, have an accurate assessment of how bad it is before you start treatment. And then you want to monitor the effectiveness of that treatment over time. If it's insomnia, again, you want to be able to initiate appropriate treatment and monitor that treatment. And even if it's just behavioral sleep problems, more around just the environment and timing, irregular timing of sleep, this technology can provide feedback on a daily basis around sleep quality and sleep timing, and sort of give recommendations that are supportive of, good sleep habits. So I think if you only have a single snapshot evaluation of your sleep, it just limits the amount of information you have to be able to intervene to improve sleep.
And I think if I could just add to that, from a consumer perspective, in terms of improving healthy sleep or improving healthy sleep quality, then the insights that you can get from devices like this, such as whether you've had a restful night or whether it's been interrupted, which could be for a number of reasons, and then the data insights over time can help you improve those behaviours, or help the consumer recognise what helps them to have a good sleep versus what helps them, or what impacts their sleep. And then the device like Remy can also communicate with other things, and that's our sort of future plans to interact with other devices such as light, temperature, adjusting the bed to fit the particular person's needs. So there's a lot of opportunity to improve sleep quality over time with these kinds of devices.
I see. And one more question on the sensor. Are those sensors embedded under the mattress waterproof, whether the sensor needs to be connected to a power supply?
Yes, so there's actually no current flowing through the sensors themselves, and the sensors are, I guess, they're heat pressed. So it's kind of like a hot iron. They're heat pressed to the underside of the mattress, and the underside of the mattress cover. So the mattress covers that we're using are medical grade mattress protectors, and they are used routinely in aged care facilities and hospitals, and those covers are waterproof. So there's no liquid can get through the covers to the sensors. And then the sensors are low powered anyway, in terms of it's less than 5 volts. So there's from a risk, there's no risk really. And then the mattress protectors themselves are waterproof as an industry standard.
Great, thank you. Thank you both of you. Thank you, Dr. Tucker, and also Dr. Vakulin. And thank you for your presentation as well. And goodbye, and we hope to meet you in person one day.
Hello. My name is Christoffer, and now I want to tell you how we in Aarhus Municipality in Denmark are working on a project to improve sleep for residents living in nursing homes. So first, just a small introduction to who am I. My name is Christoffer Rinder Larsen, and I work as a project manager in Aarhus Municipality, in a small department where we work with test and evaluation of assistive living technology. I had a background as a physiotherapist and also a master degree in clinical science and technology, and also a master in biomedical design. Now I work as a project manager in this sleep monitoring project, and I've actually just started in this project for August 2022. But the project has already started in 2020, so there have been some previous project manager in the project also. Yeah. So first of all, I just want to introduce you to the need why we are working with this project. So sit back and relax. I'm doing a little bit of storytelling now. So here is Marie. Marie is an elderly woman. She's resident living in a nursing home in Denmark. Marie has dementia. Marie is often up at night where she's confused and thinks, where am I? She walks around in her apartment, especially at night, and sleeps only a few hours each night. As Marie has cognitive impairments because of the dementia, she cannot verbally express to the caretakers if she has sleeping problems. So here you see the night caretakers have found Marie outside her bed in the night. When residents like Marie cannot express how they are sleeping, the night caretakers has to use a lot of their time to doing safety check-in if the residents are lying in bed during the night. However, it is far from all residents like Marie who will be registered by caretakers to have a sleeping problem. So when caretakers don't have any information on how residents like Marie are sleeping and feeling, they cannot act with different interventions that can support better sleep for the residents. Because of the lacking sleeping information, many residents with dementia are dealing with sleeping problems in nursing homes. So here a more generally look on the data of the sleeping problems. We know that the scientific studies show that around 75% of all residents in nursing homes experience sleep and circadian rhythm disturbances. And this can lead to these health complications and can, for example, affect the overall well-being and quality of life for the residents. And it also can worsen the symptoms from dementia. In some cases, there also can be aggressive physical reactions to residents and staffs at the nursing homes. So what current solutions are there to handle this need? Yeah, as I've just told you, the traditional way to do this is a manual check-in with the night caretakers. But as I just described, that isn't that efficient. So in this project, we have also done a little market analysis and to see which technical solution there is to solve this need. So many of you may know this the consumer wearable tech market with a lot of different bracelets. We know, for example, Apple Watch and Fitbits, and all these have the opportunity to monitor sleep monitoring. But the wearable bracelet opportunity isn't a good way to handle the project with our target group, that is people with dementia, because they see the bracelet as a stranger thing and maybe take it off when they have forgotten why they have the thing on their arm. So we cannot use the bracelets in this situation. There's also sleeping sheets, but however, they are not that compliant with our general data protection regulation here in Europe. So we cannot use those sleeping sheets. There are also different kind of camera solutions, but they will neither work in the municipality in Denmark because of the Danish laws in terms of the surveillance issue. But actually, prior to this project that we're running now, we have had some tests and evaluation with a more specially designed wearable tech solution for this purpose that have shown that, and you can see it on the picture here. It is attached on the back on the user, and below you can see the overview of the data that is visualized for the caretakers. And the evaluation from this project we have run in Aarhus Municipality was that there is some potential support, that it can potentially support a good night's sleep for the residents. But the wearable solution doesn't fit all residents, because in some situations the caretakers also has to know if the residents are lying in bed or not, if the resident maybe has fallen into sleep in a bed, in a chair or something like that. So the wearable solution doesn't fit all, and that's why we have come to that point that we need to design a bed sensor system in this project we are running right now. So this need for a new solution has led to this project we are running right now, which is a public-private innovation project that is funded by the Nordic Innovation Foundation. And the project has started in 2020, but the pilot testing has been postponed because of the COVID. So we are still running and about to go out and have the pilot starting right now. Yeah, the project is a part of what we call the Nordic Smart City Network, and this is a collaboration network which with different Nordic cities in the Nordic innovation. The aim in this network is to create supportive urban environments and living to improve health and quality of life. So the project, the municipalities that are collaborating in this project is, as I just mentioned, I'm from Aarhus Municipality, and we are the leading partner of this to run this project. We also have other municipalities collaborating, which will take part when we are going to have the pilot test in the nursing homes. The companies that are designing and develop the product we will test is the Danish companies Develco, who will deliver the hardware, and the Danish company Amplex will design the software and an app solution. More about later. So the overall aim with the project is to design a GDPR-compliant sensor system to monitor residents' sleep and objectively evaluate the caretakers' interventions to improve residents' sleep and circadian rhythm. A secondary goal is also that we want to generate insights on sleep monitoring across the Nordic countries. So we have run this project for some years now because of the postponement of the corona. But back to the beginning of the project, we started the project with some co-creation session and some design sprints to have a better understanding of the challenge into the sleeping area, and also defining the user journey to use this new system. So we invited all the most important stakeholders into this sleep problem. So both tech developers and healthcare professionals and project managers from the municipalities, and also sleep experts to have a more deeply understanding on how important is sleep and what should we do to better the sleep. So yeah. On the project, on those design sprints, we were defining also the user journey to understand how we should use the solution when it was finalized. And here you also see a short screenshot of a mock-up, because a lot of discussions in those workshops were also how should data be visualized for the caretakers. So yeah, here you see an example of one of the participants have made a drawing of how the participant thought that the caretakers could use the data. So now I just want to present you the user journey that came off from one of the design sprints on how the final solution should be used for practice. So just a little storytelling once again. So here is Eric and his nurse. The night caretaker have registered. They have a concern that Eric is awake during the night. Therefore, the different healthcare professionals have a meeting with Eric to clarify if he has a sleeping problem that needs to be addressed. Together, they make a plan to start the sleep tracking system for investigation of Eric's sleep habits. The nurse gets the sleep tracking suitcase and install it in Eric's bed. After 3 days, the caretakers has sleep data from 3 nights of Eric. She noticed that Eric has been up from the bed multiple times during the night. The nurse and the caretakers is having a short meeting talking about the cause of Eric's sleeping journal. From data of the digital journal system, they conclude that Eric is dealing with pain during the night. Therefore, the nurse contacts Eric's general practitioners to increase the dose of painkillers for Eric. After some days, with increased dose of medication, the nurse evaluates the intervention. From the sleep data, she observes that Eric is now only out of bed 1 time per night, and concludes that the painkillers have solved Eric's sleeping problems. When Eric's sleeping now is bettered, the nurse and the caretaker now agrees to end the sleep monitoring with Eric. So yeah, that was just a little example of how the final solution should be used in with the real world. But now I just wanted to show you how the prototype looks right now that we are about to test in a usability study. So you see at the picture here, there is two different sensors. The biggest one is as kind of a smart sheet that is placed under the mattress in the bed, and that will detect if the resident is lying in bed or not. The other sensor is the little sensor just below in the picture there, that will detect vibrations in the bed, so that will detect if the resident are lying in bed and is uncalm or restless during the night. So some information that the resident is actually lying in the bed, but maybe is not sleeping. Yeah. And the data from those two sensors are then sent wirelessly to what we call a gateway, which will transfer all the data anonymously to a cloud solution. Yeah, the data then will be visualized in an app. You will see a picture here, which is a prototype of how the app solution will be in the end. So the time when the citizen goes to bed and leaves the bed, you can see here in the picture, and the app will also gives data on the total time in bed and numbers out of the bed. Yeah, and as I've told, we are just started to test the usability of this prototype, and yeah, we have been the project has been postponed a lot for many months now because of the COVID, but we are just about to have some valuable feedback from the users now, and we have had some data that the system isn't that reliable enough, so we have had to make some minor changes to solve all the connecting problems between the hardware sensors. Yeah, but the results until now is that the data that the system delivers for the caretaker is valuable, and they can use it for different interventions. But however, there is this technical issues that we have to solve before we go to a larger pilot test. And also another conclusion in this minor usability study is that there has to be as few wires as possible, and the solution also has to be as invincible as possible, because we have the target group with the residents with dementia that will maybe notice the sensors as a stranger thing, and we have some examples that they have thrown the sensors away because they don't know what it is. And yeah, that's what people with dementia in some cases can do. Yeah. So just about our partner cities, when we have done our usability studies, we are ready to go out in a larger scale and test the system and how the system will work to better the sleep for the residents. And we'll do that in our collaborating municipalities with Copenhagen and Southern Jutland and Helsinki and Tórshavn. And we are planning to start here in November and will run until the mid of 2023. Yeah, and I've just told that the general aim is to test how will the effect be on sleep and the quality of life. The methods we are using in this pilot is that we will give 3 prototypes for each collaborating municipality and nursing home, and they are free. The caretakers are free to invite interested residents or relatives to be included in the study. We have some inclusion criteria that they of course have to have some kind of cognitive impairments to be included in this study. Yeah. And how will we evaluate on the effects of the system? On the quality of life, we will use a questionnaire, the questionnaire WH5, and also some interviews, because we can discuss how are the actually users able to answer questionnaires. So there will also be a lot of interviews with the relatives and caretakers to give points into this, how our system will increase the quality of life of the citizens. Then we of course also will use all the data from the sensors to evaluate on the effect on sleep. And we will also have notes and interviews with the caretakers to clarify if there is still some usability issues or it actually will work. And also we have we want to evaluate if there is some kind of business case into this, if the system can release some time, especially during the night for the caretakers. And in the end, we also have that perspective that we will use the technology readiness level to evaluate how big the commercialization potential is for the companies. So when we are ready, we have the ambition that we will have some great results on different perspectives. For the residents, we hope that we can improve sleep and increase the quality of life. For the caretakers, we hope that it will better the working environment. And for the municipality's perspective, we hope that there could be maybe a positive business case. We don't know yet. And for the company's perspective, we hope that they can get a very good feedback to commercialize a final solution. So that was my presentation about this project we're running in Aarhus Municipality with Nordic Innovation. And here are my contacts. If you have some further questions for me, don't hesitate to contact me. And you can use the link for some more information about the project.